My name is Joanne Horning, and I'm the founder and executive director of the San Francisco Bay Area affiliate of Susan G. Komen. Thank you for joining us for the third presentation of our educational web series, featuring monthly discussions focused on current breast cancer issues and presented by prominent Bay Area physicians and researchers. This episode is underwritten by the Corrette Foundation. I am pleased to present Dr. Kathleen Welsh, founder and principal of Bay Area Cosmetic Dermatology and Bay Area Body. In this episode, Dr. Welsh will discuss how to have healthy skin, hair, and nails during cancer treatments. At Susan G. Komen, our goal is to save lives and end breast cancer forever. Thank you for joining us.
Hi, I'm Dr. Kathleen Welsh, and I've been practicing dermatology in San Francisco for over 20 years. Today I'm going to talk about how to have healthy skin, hair, and nails during cancer treatments. Many times my patients come to me before they start treatments with concerns about their appearance during chemotherapy or radiation. And so I've gathered together a few tips and some information that hopefully will help you. Well, how should you care for your skin during chemotherapy? First, you have to understand what changes you will see. Your skin may become drier, your skin may become more sensitive and more prone to bruising or even tearing. Your skin and or nails may become discolored, and your hair may thin or even fall. Some chemotherapy drugs make skin more susceptible to sunburn, and so it's super important to use a sunscreen every day. Physical sunscreens are the least irritating. Look for a high concentration of zinc oxide and titanium dioxide. With so much going on, again, why is skincare so important? Healthy skin is important to your physical well-being, but for most of us, looking healthy makes us feel better. We always say look good, feel good, but it's also important for mothers and spouses to maintain a healthy appearance so that they do not needlessly worry their children or their loved ones about some of the changes that are happening. It's also important for your physical health. Dry, sensitive skin is prone to inflammation, itching, and can become a portal for infection. Your skin is your biggest organ and is the barrier against germs and chemicals from the outside world. So what can you do? It's most important to be proactive. You need to begin to treat your skin to a gentle hydrating program every day. And you have to understand how you can truly moisturize your skin. Many people think you hydrate your skin by drinking more water, but the inside and outside of your body are separate. You can't satisfy a thirst by taking a bath and vice versa. You need to keep your skin hydrated by keeping the barrier or the outside portion of your skin intact. And this begins with actually cleaning your soap. When you're bathing, lather only areas that have body area glands. These are the areas obviously in the groin and under your arms. Use warm, not hot water. And it's very important to avoid dishpan hands. Dishwashing detergents are made to remove grease from plates, but they also strip our skin from its own natural oils. When you're picking cleansers, in general, you want to pick gentle cleansers. Look for soaps that are made from glycerin or soap-free milky cleansers. You especially want to avoid antibacterial soaps and scrubs, and avoid deodorant soaps, which can be very harsh. When you're looking for a cleanser, a milky facial cleanser without fragrance, such as over-the-counter brands Cetaphil and CeraVe or Vanicream, are good products to pick. The hands are especially susceptible to damage during chemotherapy, and that's because everything we do with our hands. Most of us wash our hands at least 10 times a day. Do not use dishwashing liquid to clean your hands. Remove your rings before washing so that soap doesn't accumulate underneath the ring and cause a rash. When possible, wear gloves. And you should moisturize your hands after every hand washing. Antibacterial waterless cleansers such as Purell are alcohol-based and can be very drying, so you need to moisturize after using those also. But how to truly hydrate your skin? Take a bath if you can. Use comfortable, not hot water, and you need to soak until your skin is pruny and wrinkled. Then your skin is fully hydrated. If you can't soak to seal and moisturize your tub, then use an in-shower moisturizer. And then when you step out of the shower or step out of your bath, you need to trap that moisture in your skin by applying a good moisturizer within 3 minutes of getting out of the bath or shower. And it's really important since the humidity of our skin, the humidity of our environment determines the hydration of our skin. If moisture is applied within 3 minutes, then the water does not evaporate into the air. If you're pressed for time, then only moisturize your arms and legs. You might also want to use a chapstick after a bath to keep your lips moist. And these are some common moisturizers which are thick and are gentle and would be appropriate for any patient having a cancer treatment. And again, they only work if applied right after your skin has been in water. They don't moisturize, they just steal water into your skin. There are also some specialty moisturizers. Look for products that contain hyaluronic acid or products with ceramides, which mimic some of the natural oils in your skin. I've listed some of the brand names of some of these products. These are special high-end moisturizers that act as humectants to attract moisture deeper into the deeper layers of your skin. Another problem that patients face with chemotherapy is easy bruising. Bruising on chemotherapy usually comes from a lowered platelet count. Move carefully. Avoid twisting motions to the skin. Once you're bruised, you can use vitamin K creams and camouflage cosmetics to hide bruising. Remember to avoid other blood thinners such as fish oil, omega-3s, flax, and vitamin E. I think the most common concern for most women and many men is hair loss. Our hair is constantly growing with old hairs falling out and being replaced by new ones. Some cancer treatments make people lose all or some of their hair. Most often it comes out in clumps during shampooing after brushing. Sometimes clumps of hair are found in the pillow in the morning. It's normal for both men and women to feel upset about losing hair. For many women, our hair is a symbol of our femininity. We brush it, we look at it, people comment on it, and once you lose your hair, you really do look different, and it really becomes clear that you're undergoing a treatment. It helps to know that your hair will grow back, and then you can take steps to make its loss less of a problem for you. Hair is lost when chemotherapy drugs damage hair follicles, making your hair fall out. It can be hard to predict which patients will lose their hair and which ones won't, even when they take the same drugs. Some drugs can cause hair loss on the scalp and loss of even pubic hair, arm and leg hair, eyebrows, and eyelashes. Some drugs cause only the loss of head hair. Radiation therapy to the head often causes scalp hair loss. If hair loss is going to happen, it most often starts within 2 weeks of treatment and gets worse 1 to 2 months after starting therapy. Your scalp may feel very sensitive to washing, combing, or brushing, but hair often starts to grow back even before treatment ends. Wigs. If you're concerned about hair loss, consider shopping for a wig before your treatment begins. That way your stylist can match your existing hair. Make sure the wig is adjustable because it will fit a little bit looser when you lose your hair. You may even consider cutting your hair quite short before or even shaving your head prior to hair loss. Insurance may cover some wigs, but make sure that the doctor writes a prescription for a cranial prosthesis, not a wig. When new hair starts to grow back, it may break easily at first, so avoid perms and dyes for the first few months. Keep hair short and easy to style. Consider also, if you're very concerned about hair loss, what's called the penguin cap. This is a new invention that keeps your scalp extremely cold during your chemotherapy treatment. When patients use the penguin cold cap system, more than 86% of users can save their hair. Many women are also concerned about their nails and are surprised to look down and see discolorations or lines, sometimes occurring months after chemotherapy. If you regularly get manicures, it's fine to continue, but don't let the manicures cut or push back your cuticles, which may open a portal for infection. If you decide not to continue manicures, your nails may look better if you moisturize them with Vaseline or an alpha hydroxy moisturizer. I've listed some of the common over-the-counter ones, amlactin, lachydrin, or Eucerin Plus. Skin may also change during radiation therapy. The skin changes you'll see during radiation therapy are similar to those you would see with a mild, moderate, or severe sunburn. It's important to moisturize before and after treatments. Use a mild or prescription steroid cream for itching, and report any skin breakdown to your doctor immediately. What about treatments that you usually do as part of your beauty routine, such as regular facials? It's fine to continue getting gentle hydrating facials and massage during your treatments, but avoid microdermabrasion, chemical peels, and laser treatments. If you have more questions about skin changes during your cancer treatments, please feel free to ask your dermatologist or your oncologist. If you don't ask, you won't know. And there's lots of information online from the American Cancer Society. We have selected a select group of products that are that are appropriate for any patient undergoing chemotherapy or radiation treatments that are also available on my web store at www.weloveskinstore.com. Thank you very much.